in the cardiology department as a physician, assisting the cardiologist Dr. A.K. Abraham. So I was there for about 1 year. Then I moved to um, Trivandrum, another private hospital in Simi Medical Center. Then I was the physician there, doing independent practice. That was the time, it was in 1987. So the thought came to my mind of my starting a good multi-specialty hospital. We had a property in the heart of Pathanamthitta town where all of us wanted to start a hospital. That's an ideally located place. But my uncle, who had already been here in Calicut for 10 years, he came here in 1977, Mr. Babu. So this was in 1987. He somehow persuaded me to come to Malabar. Because my uncle, though he is my uncle, we were going together to the school because he is only just 1.5 years elder to me. So he was the last of the 11 siblings. So we were just like friends. So he somehow wanted me to come and start here. And then I don't regret at all because Malabar is such a nice place. The people are so good that he realized 10 years back. So that was, if I had started in Pathanamthitta, I don't think I would not have made, at least a big hospital like this. So we came here, he said there is a property, it's a hospital which has already been closed, why don't you come and see? So I came along with my wife and we saw the Manapad hospital and the negotiations were going on and I was not very happy to acquire that. Meanwhile, another building was available. Somebody told that one building is available. That was the RC Road Hospital where we started. That was Taj Hotel. So he wanted to give it on lease. So we took that on lease. That hotel was looking good with glass panes and other things. So what we did now, we took it on lease, converted that hospital to a hotel to a hospital. And I was the only one as a doctor in my family. So we started in a good way. It was a nice, small, cute hospital, 52 beds, with 4 departments we started. Those doctors who have joined me in 1987, they are still with us. Only 4 departments. In 1988, again this negotiation with the Manapad hospital again came to this thing. So then it went on and we could purchase that without paying much, or rather much less than what we had offered the previous year. That was the destiny, the God's wish that we should buy that probably. And we acquired that, started renovating it, started constructing more and more floors, then acquired few more land. Like that it went on. So in 87 it was 52 beds, 88 once the Manapad was started, another 80 beds there. Then by 88 to 92 it was about 160 beds. By 95 we started the construction of the present the 11-story building. By 2000 it was 480 beds. In 2005-06 we started the construction of the new block, the present block, and we finished it, and last month we got it inaugurated by the Chief Minister. Now it is an 800-bed hospital. In 2009, April onwards, this is a public limited company. Till then it was a partnership firm. Now I am proud to say that this is the largest hospital in the corporate sector in Kerala. There are many bigger hospitals, but in corporate sector, it is the largest one. So I told you that this was started as a family business, as a small venture, a very humble beginning, but with full support from the family, and they had pumped in money. We could acquire the other land and other things. From 1992 onwards, this was the firms got separated, in the sense for all for good. Independent charges were given to me as to run the hospital, and others they had taken over the other firms and other things. So went on like that. This is a short story of my present status. I don't think I should elaborate on my stories and other things. But, pardon? Yeah, no, I will tell. So I should not be stopping with the story alone also. This, so my family had made me and put me on a right track. That's what, in 1992, I told you that this was given as an independent charge to me. So, though they had put me in a right track, as Mark Twain said, don't be happily sitting on the right track. If you are on the right track, you don't be happily sitting there. You should move forward, otherwise you'll be hit from the back. So I kept on moving and still moving. So I might move, or I am planning to move further. We are planning to start hospital in Cochin, and maybe, if God willing, in other parts of Kerala and South India in the future. This we could achieve mainly definitely by a strong belief in God, of course, because it may or may not be liked by businessmen, but I will have to tell that it is a God's grace, definitely. By diligent and ethical practice by our doctors, the honesty and integrity they had shown, by having a humane mind with concern towards poor and the distress. This, we have entered the 25th year, this is a silver jubilee year. So last month we had announced for free heart surgeries, free cancer treatment, radiation treatment, and such things. For our 20th year also, we had done about 22 cases of free heart surgeries, absolutely free, no, nothing. No money was collected from any philanthropist or anywhere. It was all from our own money. This year, when I announced and when I told this, our own doctors collected 5.6 lakhs rupees within no time and gave this and presented on that day. Then another friend of mine who said we should not disclose the name, he voluntarily immediately agreed that I will give you 5 lakhs rupees. From my family again they said, Mr. Babu, I mean that group said they will give you 10 lakhs, they will give me 10 lakhs rupees. And if not more, but the cost is more than 1 crore rupees for doing 25 heart surgeries free and 50 radiotherapy free and other discounted cases and other things. So we always had a humane mind, giving, towards concern towards the poor. And the quality consciousness in all our services. We are an ISO 9001 and ISO 14000 certified hospital. Along with that, we are an NABH accredited hospital. I don't think till now any hospital in South India at least with having all the dual ISO as well as NABH certifications. As far as possible, we are environment friendly. We are trying our level best. We were the first one to, abolish the plastic bags even before our collector announced for plastic Nirvadana and all other things in the city. So we have been using the bags for last so many years. And we recycle our about 4 lakhs liters of water is being recycled and used there. And wherever possible, whatever way we can be environment friendly, we have been doing it. So, and the strong support from and the hard work of the doctors and the staff, the bonding between them, the amity between them. To keep up that, I always get involved into their family problems and especially their needs. As far as possible, we try to attend their marriages in their house, or housewarming, or any sad incidents in their house. So every year we have a get together in my house or in the hospital on my birthday. So about 1,500, 1,600 people will be invited. They will have biryani as the usual custom. This has been followed for the last 25 years. And every year we have a BMH day. It's nearing this, around this day of November 30th. We have a 2 or 3 days program, competition in many different arts and cultural festivals, events. So that's the one which is to keep up the goodness and all other the amity and the bonding within the staff members and the doctors. All of them participate there, and they are all very happy. Maybe except 1 or 2% or less than 1 or 2% who had to leave due to some reason or other, or maybe some petty issues. Otherwise, staff in general and the doctors, they are all very happily hooked to our family. And over and above, the trust of our patients and the people of Malabar, the trust reposited in us. That has been the main reason for our development and our growth to this level. I think I should stop. Yeah. So, if some questions or I'm happy to answer your doubts, queries.
Why don't you explain what is the role of Dr. Alexander?
Oh. So the success behind every, the successful businessman is you know that. Behind every successful businessman, there is a lady. Behind every unsuccessful man, there are 2 ladies. Fortunately, I got only 1 lady. So she is here to listen to me whether I am going to tell anything which I have not told her so far. Of course, when I said the family, I did not mention her because she doesn't like my blah blah telling her in front of her. So that's why I didn't tell her. She is the executive director of the Memorial Hospital. She is there in all the day-to-day activities of the hospital. As far as possible, she will be there in her office. But if she is engaged in something else, then she may not be able to come. But sitting at home also, she is having a remote control over everything, including me. So that's a success.
Your message for development of Kerala and to the state, to the youth of the state.
For the development of Kerala, we need a lot of infrastructural improvement. That is what we are lacking. This has to come from the main motivation has to come from the political, the topmost people, and definitely the support from the public. See, unfortunately, we couldn't have during the last ministry, not this, the previous one. They are planning an express highway So much of criticism about that.